Okay, I think we'll get started. Good afternoon. And again, thank you for joining us today for our monthly webinar co-hosted by the MGH Institute of Health Professions Center for Climate Change, Climate Justice and Health, the Massachusetts General Hospital Center for the Environment and Health, and also Brigham and Women's Hospital. We are delighted today to have Dr. Cecilia Sorensen join us to share a little bit about the work that she's doing. Dr. Sorensen is the director of the Global Consortium on Climate and Health Education at Columbia University. She is an associate professor of emergency medicine at Columbia Irving Medical Center and associate professor of environmental health sciences at the Mailman School of Public Health at Columbia University. As a physician investigator at the nexus of climate change and human health, translating research into policy, clinical action, and education in order to build resilience in vulnerable communities is the focus of her research. So welcome, Dr. Sorensen, and I'm going to turn it over to you.
Thank you so much, Sue Ellen, and delighted to be here today. It's such an honor to see everybody in the virtual space. Give me 1 minute and I'm going to share my slides. Okay. Alrighty. Okay, and Sue Ellen, can you see my screen in a good light?
I can, yes.
Okay, fantastic. Wonderful. Well, again, so delighted to be here today. My goal is really to share with you a perspective on how we can think about how we prepare this current generation of health professionals to really tackle these monstrous challenges related to climate change. It's something that I've spent a lot of the past 2 years thinking about, working in partnership with many people on this call today around. And so, yeah, I mean, I'll just kind of start there and say that, this is really a work in progress. And I think that there's just so much opportunity in this space to really leverage the expertise of health professionals to address issues related to climate and environmental health. So I have no conflicts of interest to declare, and I've been told that this audience knows quite a bit about climate change, so I'm not going to belabor this, but I do want to draw your attention to 3 high-level concepts that I think really sort of can serve to frame this conversation. So the recent IPCC report, actually that was released almost a year ago now, 3,000 plus page document, really our best science in terms of how climate change is occurring and how it's having impacts. I want to draw your attention to really 3 main findings, just 3. The first one being that of 11 categories of diseases and health outcomes influenced by climate change, which together contribute to 70% of global mortality, all of these are actually found to be climate sensitive, meaning that their frequency, their distribution, their prevalence is being affected in some way by climate change. So we zoom in here, we look at malaria, dengue, diarrheal diseases, respiratory tract infections, non-communicable diseases. We know that as a result of climatic exposures, that people who have these infections or people who don't have these diseases could potentially be affected by them or have their health outcomes as a result of them changed. We also know from the IPCC that we are seeing widespread impacts across human systems. And so this is a diagram where the darker the circle is, the more evidence we have that these impacts are occurring and that they are attributable to anthropogenic climate change. So we see here that with high to very high confidence, our best science is telling us that climate change is already undermining human systems across the globe, which are vital to stable and secure livelihoods. That includes water security, agricultural production, livestock and fishery yields. Again, in the middle column here, we're seeing direct impacts on human health through infectious diseases, through heat, through malnutrition, mental health, displacement. And we know the escalating impacts are being felt across human cities, settlements, and infrastructure. And so this is not, I think, surprising to this audience, but again, just sort of trying to, frame the breadth and the depth of this issue. We also know the second high level finding is that climate change is worsening health inequities. So we know that everyone is affected by climate change, but that those who are vulnerable or marginalized in any way, in any part of the globe, are going to be feeling these impacts first, and they're going to be feeling them worst. Just some data here, nearly 2/3 of the morbidity costs from climate change are being shouldered by our Medicare and Medicaid patients. And the World Bank Group has shown that within the next decade, up to 132 million new people may be pushed into extreme poverty as a result of climate change. And this is, I think, the most important finding. With all these challenges that we're facing, our best science tells us that the severity of climate-related health risks and impacts is highly dependent on how well health systems can protect people. So there's two ways of looking at this. Climate change is the biggest global health threat of the 21st century, but on the same hand, tackling climate change could be the greatest global health opportunity. But if we want to turn this threat into an opportunity, our best science tells us that we really need health systems to be prepared. We need a health professional workforce which is ready to prevent, prepare, and respond to climate-related impacts and how they affect our health. And so really, when you step back and think about this, the potential for us to create change is enormous. If you just look at the numbers of doctors, nurses, dentists, and pharmacists, globally, we are almost 50 million, right? That is a huge number of health professionals. And that's not even thinking about veterinarians, about social workers, about emergency workers. Everyone who sort of intersects with the health sector and is really, an ambassador for health. I'd say the numbers are probably more like 200 million, right? And so we are a huge workforce, right? And we're everywhere. And that's, I think, the beauty of us as health professionals, is that we are already embedded in communities. And when you ask, people, who do you trust the most in your communities, of all the professions, of course, nurses are always the most trusted, and then doctors, and we see pharmacists, we see high school teachers, but these Gallup polls that are done every few years, again and again, show the health professionals really have this social contract with our communities. We are society's confidants, right? And our messages are trusted. Interestingly, health professionals are very attuned, and we understand this impact of climate change on health. So this was a study that was done in 2021 by Kocher and his colleagues, published in Lancet Planetary Health. Probably too small for everybody to read, but what they found is that when they surveyed health professionals internationally, many already feel that climate change is impacting the health of their communities and their patients, and feel like they want to do something about it. And education and knowledge is again identified as a barrier, as well as a tool to overcome these challenges. So in 2017, the Global Consortium on Climate and Health Education was formed out of the Paris Conference of Parties, or COP15. And so there was a special meeting that was convened where there were deans from about 60 different health professional institutions globally. And they said, we've got to do something about this. And they got in a room and they said, let's form a consortium. And that's what happened. And so this consortium was formed to ensure that 100% of health professionals globally have the knowledge and skills to recognize, respond to, and prevent climate-related health impacts. So we organize, we empower, and we amplify the voice of health professionals to convey how climate change is harming our health and how climate solutions will improve it. So how do we do this? Well, we obtain commitments from health professional schools to educate their students. We bring together our institutions to create and share best scientific and educational practices. We develop global standards and resources, and we work to build a pipeline of health professionals that includes students, faculty, people in communities, to focus their work on climate change and health. And so the consortium started out with 60 members. And as of yesterday, we are 294 members strong. We just had an institution in Northern Turkey join us, which is fantastic. These schools are all over the globe. As you can see, we are present in about 60 different countries. This includes schools of nursing, public health, medicine, pharmacy, dentistry, social work, and veterinary medicine. We also have many incredible NGO, government, and health association partners who we work with on programmatic development and implementation. And this is incredibly valuable to our strategic goals and to our day-to-day operationalization of the work that we do. And I'll get to that in a little bit here. So what do we know currently about how climate and health is being integrated into US schools of public health? So stepping back and sort of saying, where are we right now? And let's just look at the US. Well, there was a study by Hendricks in 2019 who looked at all CEF accredited graduate programs and courses and found that, yes, climate and health courses are being offered. However, they are all being offered on an elective basis. And so that, it's good that we are getting sort of the knowledge and expertise trickling into schools. However, this is not really getting broadly integrated into the training of our public health professionals who are going to be running health operations in the future. So that's concerning. In 2019, Becker et al. Looked at CEF accredited MPH programs and found that no school offered a climate track for the MPH certificate programs, and no school is currently requiring a course in climate change. So we have huge gaps sort of throughout schools of public health, and we don't have as much knowledge really of what's going on globally around this, although we're working to address that. When we look at medical school education, this was a survey that was done in 2020, and 15% of medical schools have incorporated climate change and health into their curriculum. However, to what degree is that elective or is that required? It's kind of unknown from this study. 12% of schools report having student-led climate-related programs. But when you ask sort of graduates from medical training programs, 40% of them will report that they feel like their environmental health education is inadequate. So we've got some gaps, right? And so in 2020, we did an assessment of our consortium members and we said, guys, what are the barriers? What are you facing? Because this is how we need to start thinking about providing tools and resources to overcome it. Many felt like they don't have staff time to really be engaging in these curricular initiatives. Many don't have funding, which sort of equates to time to support development. There's a feeling that there's a lot of competing institutional priorities as well as politics. That there's no space, right? That, faculty who are advocating for this, their institutions sort of get pushed away saying, sorry, we've got get in line. There's a lot of people who want things in the curriculum. And then some reported that there's just not materials available and there's not staff expertise to really do this. So we've got gaps, right? We have ambition. We have a lot of passionate members, but there's just these really practical and really real gaps that are existing that are preventing, us from being able to provide good education, to prepare this generation and the next to be able to deal with health impacts. So at the consortium, we really have taken on this multi-pronged approach because the gaps exist at so many different levels of the health sector. We think about sort of institutions who train the next generation of health professionals, but we also think about the existing health professional workforce, right? I don't think we can wait for this generation to completely mature. We have to really be thinking about how can we involve the current decision makers, the current program planners and policy implementers, and health professionals in the clinical world everywhere to be able to do this work. So we have a multi-pronged approach. We support institutions and faculty who train students. We support existing health professionals through continuing education opportunities. We provide technical support and partnership to health professional societies and associations. We work to promote transdisciplinary climate and health research. We partner with government and intergovernmental organizations to provide technical support and consultation. And we do a lot to support student and student-led initiatives. So when we're thinking about training health professionals and this notion of capacity building. One way that I sort of think about this is the many roles that health professionals have in communities, right? So there's clinicians, some are researchers, all are trusted community voices. Some are institutional leaders or will be institutional leaders, and everyone is a private citizen. But the reality is that in whatever way a health professional is manifesting their profession, they are trusted community voices, and they have a lot of power, often more than I think we do, to step out into the world and to really affect change in institutions or in our communities. So I just want to give some examples of some of the ways we've been thinking about this notion of competencies as it relates to health professionals. One of the things that we do is we basically every 18 months, we iterate our GCCHE core competencies, and they cover these 5 major buckets, which are climate and health knowledge and analytics skills, climate change and public health practice, climate change and clinical practice, policy aspects of climate change and health, and climate and health communication. And the way we come up with these competencies is that the first iteration was developed by a group of international experts who then became our coordinating committee. And with every iteration, we put our competencies through the coordinating committee and we ask them to say, are these competencies still relevant? Is there new information or emerging science that we need to integrate into our competencies? Are we missing anything? And so we just went through that process, and then we send out our competencies to all of our 300 institutions and we solicit their feedback. We say, what are we missing? What do we need to emphasize? And so this is really a living document that we know will grow and change. And we think that's important because this is not a static problem. And it's also a very rapidly developing science. So we think about sort of these thematic buckets of competence. And then we think about, how do we focus these skills in different areas? So for example, what do we need to train health professionals to do in terms of primary prevention or of secondary prevention or of tertiary prevention? So similar to most public health measures, we know that actions taken at the primary prevention level really have increasing population impact and more return on investment, while actions taken at the tertiary level require increased individual effort, increased resources. And quite frankly, in the US, we really focus on tertiary prevention. We are very reactive to climate-related events as they happen in our communities. And so how can we really think about getting our health professional workforce trained to be doing the primary prevention, secondary prevention work, and of course, also the tertiary prevention work, which we do really well already. So just to give you some examples of how we're sort of thinking about this, what do public health professionals need to be able to do for primary prevention? Well, we say it's to build the evidence base to understand the interactions between climate change and population health. This is a field of emerging research. We need more information. We need to understand, how local impacts are going to manifest. We need to understand future predictions of how impacts are going to manifest. So we really need to be thinking about building the evidence base to understand these interactions. We also need our public health professionals to be performing vulnerability assessments to understand in communities, in states, in regions, who is most vulnerable. And we need to really have a baseline sort of assessment of where we are with climate and health impacts so we can do predictions into the future and then be able to build programs that will hopefully be able to address those potential health impacts. That's primary prevention, and that's just a couple of examples of what we need public health to do. When we think about clinical medicine, thinking here broadly about nursing, clinical social work, medicine, we need to be working closely with public health, right? We need to be utilizing vulnerability assessments and translating them into bedside clinical care. How do we take what we know about impacts to population health and apply that to the patient in front of us? And as we're learning this information, we need to be creating, updating, and adjusting health treatment guidance and treatment standards, right? And we need to be thinking about also how our health systems are prepared or not to deal with climate-related impacts. I saw a terrifying map the other day looking at the number of hospitals in the US which are sitting in 100-year floodplains. And there's a huge number of them, right? And so if our health systems aren't resilient, we can't care for the patients in our communities. And so I sort of bucket this in sort of the primary prevention, and part of the role of clinical medicine is thinking about, our healthcare systems and how we sort of can protect them. And then there's a lot of work that we need to be doing together, right? I think this is really a team sport. So public health professionals are doing their part, clinical professionals are doing their part, but together we need to be thinking about how we streamline our messaging and how we reinforce the messaging around the need to decarbonize our societies, our sectors, even outside of health, to stakeholders, to policymakers, to the public, to be emphasizing the economic and health co-benefits of action. And I think that if we bring our voices together on this, the messages are going to be more powerful. We also need to be working together, thinking about how we decarbonize the health sector. As many of you know, if the global health sector were a country, it would be the 5th largest emitter of greenhouse gases on the planet. So all of that to sort of say, these are the roles or responsibilities that we're sort of seeing for health professionals, and the competencies lead students to be able to fulfill these roles. When it comes to secondary prevention and public health, we think about how public health professionals need to be equipped to develop surveillance and early warning systems, for example, heat wave early warning systems, vector-borne disease early warning systems, et cetera, et cetera. We need public health professionals to develop evidence-based guidance and to implement public health interventions that are relevant to climate-related exposures, and thinking about messaging, thinking about educating at-risk populations, right? This is all secondary prevention. Clinicians, we need to be thinking about, what are those individual societal, physiologic, and environmental factors that are increasing the vulnerability of the patient sitting in front of us, and how do we apply knowledge from public health and from our sort of sphere to guide decision making, to guide the way we educate and provide treatment plans for our patients. And we need to be thinking about what are these health protective recommendations that we should be making across the board. And of course, we have this shared space where together we need to be educating patients, communities, policymakers, and the public about this. We need to be thinking about how to strengthen pathways to rapidly translate scientific knowledge into meaningful health policy action. And I should maybe put this slide first, which is that we need to really think about how we establish mechanisms to reduce health disparities, right? These gaps are going to get wider and wider unless we are working incredibly proactively together to reduce them. And then we think about tertiary prevention, right? This is one of the things we do well, but we can do better, right? When it comes to public health, what can we do to implement community protective interventions prior to and during climate-related events? We need public health professionals to be able to diagnose and investigate health problems and hazards in the community related to climate change, to ascertain the climate attribution of events which occur, and to really mobilize community partnerships to identify and solve health problems. These are things that public health does really well, but that we are not necessarily applying to climate-related issues. Clinical medicine, we have to work closely with public health, right? We need to relay clinical trends and conditions back to public health bodies, right? When we're seeing, big spikes in West Nile virus or gastrointestinal diseases after heavy precipitation events, we need to be communicating with our public health professionals what we're seeing on the front lines. We need to be thinking about how we continue healthcare system operations in the setting of climate-related events. And how we proactively respond to the needs of our vulnerable patients. And, again, this is really a team sport. We need to sort of be bringing together the expertise and the knowledge of all our health professionals to improve disaster response. And we need to be doing this in collaboration with our existing local, state, and federal institutions. So if I haven't said it enough, this is a team sport. And we really have to sort of think about getting everyone sort of on board and thinking about what our roles are here and how our existing knowledge and professional training really can lend itself to the climate and health field. So our next iteration of the GCCHE core competencies is going to be launching in March. So stay tuned for that. So just a couple of examples of how we use these competencies. It's a lengthy document, right? They're quite detailed, and they're meant to be really a guide to plan, courses, to design curriculum. We use it internally to sort of guide our resource development. We find that these competencies are used to assist partners in developing guidance for their constituents. And we also use it as a guide to really as we're thinking about sort of policy interventions as well as advocacy initiatives. So just to give some examples, last year we worked with the Association of Schools and Programs of Public Health to create a toolkit for how public health schools in North America can integrate climate and health into many aspects of their institutions. So for example, in the toolkit, there's kind of step-by-step guide for how to integrate climate and health competencies into core public health curriculum, how to build a master's of public health concentration in climate and health, and even just, how to build a course. And the way this toolkit works is we took the GCCHE competencies and we took the CEF competencies, which is the Center for the Council for Education on Public Health Competencies for Health Professionals. And we saw where they overlap, right? Where we can sort of find that sweet spot. So this is just an example of how these competencies are in use. ASPHER, which is the Association of Schools and Programs of Public Health in the European region, has adopted these competencies and is promoting them for their schools in the European region. And the World Health Organization and the Global Climate and Health Alliance is using these competencies as an example of how schools can begin to sort of move forward their initiatives in this space. So many of you on this call have been part of this incredible collaboration that we're organizing out of the consortium called Climate Resources for Health Education. And the impetus for this was that based on our sort of gap assessment, many students, faculty are trying in earnest to set up programs to integrate climate and health into these already very packed curriculum with not a lot of faculty support. And so the idea for Climate Resources for Health Education was to say, okay, we've got members of the consortium across the globe. And oftentimes, though, there's only a small handful at each institution. So how can we connect all these institutions together to build resources together? And so the goal of this initiative was to produce comprehensive educational materials on climate change and health for all health professionals, to really prepare educators and students for the challenges of climate and health. We wanted to utilize an interinstitutional perspective. We wanted to make sure all these resources that we create would be very accessible. We wanted to provide implementation strategies for new educators. We want to evaluate how these resources are used, and we wanted to make sure that they were renewed annually. And so what we did was we started with a small group of members, which were at Harvard MGH and Brigham and Women's Hospital, so people on this call, at Columbia, at UCSF, at Emory, and we sat down and we looked at all of our learning objectives. We looked at all of our competencies. And interestingly, and not surprisingly, there was 80 to 90% overlap. And so we said, okay, this is sort of this small consensus of what is important for health professionals to know. We divided these into learning objectives, and then we put it out to the large community. We said, okay, we want teams of students, faculty, and residents to sign up for a specific learning objective, a specific topic. For example, what's the impact of heat on cardiovascular disease? And to create slides or to create cases, problem-based learning cases. And we provided templates for the slides, templates for the cases. And it's been really, really incredible to see what's happened. So again, this is sort of how we do it. We bring together groups of trainees and faculty advisors. They create problem-based learning cases and slide decks. They send them back to us, and then we send it out to expert review. And so within our community, we have experts from so many backgrounds who sign up and volunteer, say, I will be an expert reviewer on this topic. And so we have engaged over 500 faculty, residents, and students in this huge initiative, which is now live on the website. And all of this information is freely accessible. You can download it anytime. It's all evidence-based. It's all peer-reviewed. And so this initiative has just expanded greatly. And so we sort of started with this Climate Resources for Health Education. And now we have an incredible nursing group, which is adapting this type of process to create resources that are specific for nursing education. And they're going sort of above and beyond and saying, we are going to create materials that can apply to nurses at the undergraduate level, at the master's degree level, and at the doctoral level. And so that initiative is going to be launching hopefully in the next 6 weeks. We also have a team of pharmacists from from RX for Climate who are working to use CRHE as sort of a mechanism to create materials and resources for pharmacy education. We are promoting some work that's been done in the One Health area where we have some members who've already developed incredible cases related to One Health. And we are also developing an arm of CRHE for health systems and equity. So this is, I think a real success story in terms of, thinking about how we bring together all these institutions everyone globally who is concerned and focused on this work, let's not all have to invent the wheel. Let's share our resources. There's not enough of us, and let's make them all freely accessible and open for use. The other cool thing I didn't mention about the CRHE is that we sort of came up with a list of core learning objectives, but we have an opportunity for people to create their own learning objectives. So if you're out there and, for example, we had some ophthalmologists come to us and say, there's not enough objectives here about, eye diseases and eye health. And we're saying, oh my gosh, we didn't even think about that. Please suggest some. And now they're working on developing cases and slides for it. So this is really, again, sort of a living project. We're getting learning objectives, suggested all the time. We're getting new experts kind of coming to this space. And so I invite everyone here to sort of explore this. I don't know, Winnie, if you want to put the link in the chat for people who want to take a look at that. Another area where we see a real need is in sort of training the trainers. There's huge motivation and movement from students to say, we want climate and planetary health education in our health professional training schools. But oftentimes there's not faculty there to teach it. We also see that, sort of the global community is saying, we need our ministries of health, our health departments to be doing more about this, but frankly, no one has the training to do it. And so there's these gaps. And so as the Global Consortium on Climate and Health Education, we are offering, free certificate-based CME accredited courses for health professionals. And so just to sort of share some of the programs we've done, last spring, we did 3 courses. One was focused on North America. We worked with NOAA, Health Canada, and Project ECHO. Then we did a course which was focused just in the Caribbean. We worked with the Caribbean Institute for Meteorology and Hydrology and a nonprofit in the Caribbean called Earth Medic, Earth Nurse. And then we worked with the Pan American Health Organization and the Inter-American Institute for Global Change Research, and we did a course that was focused on needs in Latin America. And each of these courses was about 20 hours long, had sort of an assessment built into it, and people were eligible to get a certificate from this if they attended a certain number of sessions and they passed some quizzes and exams. For all these courses, we sort of offer multiple languages through live interpretation. And it was just really an incredible to sort of see how this happened. But in just 3 months, we trained and gave certificates to 5,000 health professionals in the Americas, which is, more than we thought we could reach. And I think really speaks to this realization that there are a lot of people throughout the world and throughout regions who are interested in this. And we're trying to sort of say, how do we get folks together and how do we get people up tools to be able to do the work? So as I mentioned, we evaluate all our courses. Again, sorry about this, tons of data on a tiny slide here. But what we really want to know of our participants of these courses coming out is, having taken this course, is it affecting your communication, right? Again, we see health professionals as really great communicators, great messengers, social confidence. And so we ask them, how often do you talk to your patients, community members, or colleagues about climate and health? We ask them before the course starts and we ask them at the end. And what you see here is that we see these shifts in people sort of increasing their communication. People who never spoke about climate and health to the communities are now, rarely or sometimes or frequently talking about it, right? So we're increasing communication. We ask our participants, how often do you incorporate climate change and health knowledge into your skills at work? And again, we sort of see these shifts of people taking the knowledge that they're gaining from the courses and applying it to their health professional practice. And we see people's confidence growing in terms of their ability to lead initiatives. And so just to kind of say, this is sort of how we sort of track and evaluate our courses. To make sure we're sort of moving those knobs on, are we really igniting health professionals to be doing this work in their communities? So this April, if you're interested, we are launching a Pan-American Health Sector Resilience course. Last spring, we did 3 separate regions, and now we're going to do the entire Americas. This course is being funded by Health Canada and the Pan American Health Organization. And we're working with a lot of partners to do this. The registration link I can share at the end, but this is going to be really sort of a broad course thinking about, what are local case examples of success stories? How do we sort of think about health sector resilience and what is needed there? At the consortium, we're also thinking about, we're doing sort of broad sensitization, broad sort of knowledge sharing around climate change and health. But we also realize that there are some very specific skills that we can equip people with. And so currently we just launched our life cycle assessment for the health sector boot camp, where we have enrolled 14 teams from around the world who have come from different institutions to learn the art and science of life cycle assessments. And this is, an intensive 2-day workshop where teams come together, get a lot of information, get some training. They go away for 6 weeks, collect data, meet with our mentors during that time, come back for 2 days and learn how to process this data and how to produce an LCA, which will impact decision-making, ideally, in terms of procurement and supply chains in the health sector. So we are thinking sort of strategically around, what are these specific skills that we can offer really, to globally, and not just to members of the consortium. All of our courses are open to the public. We also have a 2-day boot camp, which is actually now going to be a 3-day boot camp, which will launch in June this year, to really sort of get that, that hands-on experience with climate and health and get people up to speed with this. And we have some ongoing collaborations with Healthcare Without Harm, where we run a every 2 to 3 months, essentially, we do a webinar where we sort of bring the voices and the research of clinicians kind of to the forefront to think about, how we can use emerging science and knowledge to really work towards health sector decarbonization. So this is just, kind of a smattering of some of the initiatives we've been working on, just to give you kind of a taste of how we're thinking about addressing these huge gaps that we're seeing. I think our best resource is honestly each other. So we have a learning collaborative that meets every other month. We could meet more frequently, but that's kind of what we have right now, where we invite a school to come to the collaborative and tell us what you're doing, right? Tell us what your challenges are. And it's, it's in the weeds, right? It's actually, I think where we need to be, because at every institution, there are challenges, there are barriers for people who are trying to do implementation work. And this is, we have each other as sort of a resource here. I'm going to skip over that. I think, one of the places where we're also trying to do a lot of support is thinking about, how do we really get climate and health education to do what we need it to do, to really upskill health professionals to be able to work in this space. And so we are sort of sponsoring 2 open calls for papers, one in collaboration with the AAMC, and this is an open call for submissions on climate change and health. And we actually just closed this call with Frontiers in Public Health, and we got like 30 submissions of people who are developing curriculum, innovating curriculum all over the globe. And so we'll be able to share that special issue hopefully in the next month. But again, I think this is a really vibrant field, and we're seeing so much innovation and creativity. And our goal at the consortium is really just to kind of get it out there, get people talking, get people connecting around this. I mentioned that, one of the gaps is thinking about, ministries of health and governmental and intergovernmental organizations who have in their mission to tackle health impacts of climate change, but who may or may not actually have the internal technical capacity to do that. And so this past fall, we partnered with the Ministry of Health of the Bahamas, and we did a workshop where we trained health professionals in collaboration with community members. And the goal was for them to come away with really a plan forward for how they could work together to address climate and health related issues in their community. It was an incredible workshop, ton of fun. We did it in 3 different locations in the Bahamas. And again, we did a pre-post survey here, and we found that there were huge shifts in perception, right? People started realizing that climate change is an issue that affects them personally, people in their community, people in their country, as opposed to the other multiple choice answers here where, do you think climate change will affect people in other countries or people in the future? And so really trying to, we shifted the perception to, this is a here and now problem. Just some other data that came out of this course, what impacts of climate change are relevant in the Bahamas. We sort of realized that, through the course, we were able to increase people's knowledge and awareness of air quality, of flooding, of temperatures, of biodiversity loss, of droughts and more as terms of issues affecting the Bahamas related to climate change. And then we saw huge shifts in how health conditions are affected by climate change. So anyway, just to kind of share with you, some of the work that we're doing to sort of increase the technical capacity of governmental organizations to be able to do this work. We also work with TIFANET, which is a global organization which trains frontline field epidemiologists and currently has had no climate and health built into their education. And so we are working closely with them in partnership to really sensitize the global field epidemiology community around climate and health exposures and health impacts, because I think they're really sort of one of our front lines in terms of this, and need a lot of support to sort of get this type of education up and going. If you haven't subscribed yet to the Climate Clinic, this is a quick ad here. There's a link here. This is a podcast that we launched where we bring to you sort of every week emerging climate and health research in our Be the Expert stream. We also have a Code Red stream where we sort of go to places that are experiencing climate impacts and talk to health professionals on the ground, get their perceptions, get their perspectives on the issues. We have a stream called Be the Change, which is really kind of bringing into focus sort of solutions that are tangible, that need to be disseminated. And our students have their own thread called Cold Green. So you can subscribe to the Climate Clinic here, and I'll put the link in the chat later. So just to sort of, go back to what is our approach here, right? We support institutions and faculty who train students. We support existing health professionals through our courses and continuing education opportunities. We work to provide technical support to professional societies and associations. I didn't talk about the transdisciplinary research, but that's sort of another area of work. We partner with governmental and intergovernmental institutions to provide technical support and consultation. And we'll get to the student part next. So how does this all look? Well, we have some expressions that we use frequently, such as we are building the plane as we are flying it. We do a lot of that. We say this is the first pancake a lot, which is when we're trying a new initiative, we're piloting it and it doesn't come out exactly what we want it to look like. We say it's the first pancake, but it's going to get better. We also throw a lot of spaghetti at the wall and we see what sticks. So I think this is a really exciting field to be in, and there's just so much opportunity for collaboration. And I think we're going to start seeing a lot of changes in the coming years. So if you're sitting there thinking to yourself, how can I start this today or tomorrow? Here's just some suggestions, right? Do an internal assessment of your own gaps in knowledge, right? Where are you curious? Where do you want to know more? Where can you sort of fill in your own knowledge gaps so you feel like you're a more empowered health professional? Join our courses, explore our resources, talk to your friends about it and see what they do and what they think. If anybody is in an educator role and thinking about that broadly, right, in your communities and your institutions, do you train students in clinical settings? Think about how you can incorporate climate and health lens tomorrow, right? I mean, I think our students really look up to us, and we set the tone, we set the culture. I would say, in whatever institution you're in, Google it, right? See what your institution is doing on this, and reach out to the people who are already sort of doing sustainability initiatives to see how you can sort of play a role. And then, I think the lowest hanging fruit is start talking to your students, your colleagues, and your families about this issue. And all of this matters. I think all this kind of adds up to us sort of forming a larger movement and making change happen. We invite everyone to be engaged in the GCCHE as they would like. You can join as an individual, institution, an organization. You can be a working group member. You can lend yourself as an expert voice or as a mentor. And the QR code is here. You're invited to sign up and get our newsletters to see what kind of courses we're offering and what we're up to. And I would just say, the real heart and soul of the work that we do is our students. And so every year we take on 3 trainees into the consortium. We have a nursing student, we have a public health student, and we have a medical student. And we also have a postgraduate fellow from the Colorado Climate and Health Science Policy Fellowship. And these folks work within our consortium, and they sort of say, I think they really are our North Star in terms of, where we need to put our efforts and how we can act. So I have a video here that I'm going to try to play. And this was put together Earth Day last year by our students. So I hope this works. Let's see.
Dear health education leaders,
as a public health student,
as a pharmacy student,
as a dietetics student,
as a medical student,
as a nursing student,
as an epidemiologist in training,
I feel ill-equipped to prevent the health harms of climate change my patients and communities face.
In the recent months, climate change has fueled one of the most violent tropical storms ever faced by areas of my country that are usually spared.
Here in Richmond, Virginia, heat waves affect communities of color and low-income neighborhoods disproportionately, and yet, I'm not taught what that means for their health.
The evidence is clear for more frequent and severe wildfires, to floods and droughts, poor air quality, and increased spread of infectious diseases. Climate change is the greatest threat to health that we face in the 21st century.
The COVID-19 pandemic has already highlighted the unprecedented strain that large-scale health crises place on health systems and healthcare workers.
And low-income communities of color, indigenous communities, will suffer the worst consequences.
A whole generation of nurses and nurse practitioners.
A whole generation of doctors.
A whole generation of pharmacists will have to care for those who suffer from the health harms of climate change.
Yet there's little formal acknowledgement of the coming climate catastrophe in our education.
But the solutions we need already exist.
The Global Consortium on Climate and Health Education has resources and frameworks for educating all health professionals.
Our health education encourages us to think deeply and collaboratively about the health problems we face.
And climate change is no different.
Educating us on the impacts of climate on organ systems, structural determinants of health, health policy, and health system science is an opportunity
to prepare us to face the challenges of a lifetime.
But we need your help to make it a reality.
We need your leadership to push for sweeping educational reform,
required to prepare a generation of healthcare providers to address the consequences of climate change.
If schools integrate the impacts of climate change on health into existing curricula,
then as an epidemiologist, I will be able to better understand the interaction of climate change with health risks and health outcomes.
As a physician, I will be able to talk with my patients about the impact climate change is having on them.
As a nurse, I will be able to provide heat action plan for my patients in a heat wave.
We, as health professional students, will spend the entirety of our careers working with patients and in communities increasingly impacted by climate change and environmental degradation.
With the proper training,
we can fulfill our duties as health professionals,
secure the health of our patients,
and achieve a more just society.
Ah. Okay, that's it. I get chills every time I hear those students talking. They're lovely. I don't know how they put that together beyond my technical capacity to do, but thank you all so much for your attention. And if there's time for questions, I can stick around.
Dr. Sorensen, that was incredible. Thank you so much. It's amazing how much work you do and how you're able to put it into 45 minutes. And that was just a whirlwind tour of all your multifaceted work. And I have to commend you and your organization because I've benefited a lot. I know my colleagues and globally as well. I think one of the most impressive things is how you really took people who are working in silos and really tried to build a global community. So thank you. I welcome people to put information or questions into the chat. And I see that, Cecilia, you're already like multitasking and answering as they come along. So as people put in questions, I have one for you, actually. I'm going to just make sure there's, okay. So I'm curious, you mentioned measuring impact. And I think one of the things you mentioned was the survey of perceptions of knowledge. And it may not exist, but I'm just curious, is there any thought or way to measure impact in another way, whether it be on a community level or patient outcome level?
Yeah, that's a really, really important question. You know, I see that you know, sort of on a national level, some countries are doing HNAPs, right, where they're doing these nationwide vulnerability assessments to sort of say, you know, is our health sector ready to deal with these issues? And so if those are repeated annually, you know, we will be able to see some change there. I think there's, there's tools which can sort of assess the resilience, the infrastructure resilience of a hospital or health system. But I have not seen a good way to assess, the readiness level of health professionals in communities to really be able to address this. So I mean, I'd love to sort of talk more about that, because I think it's where we need to be. How do we sort of have indicators and track them, so we know that we're moving towards what we want. But it's a great question.
Thanks. Sue Ellen, I see you wanted to say something.
Yeah, great overview, Cecilia. That was wonderful. And the work, I also am just in awe of the work you do and how you've managed to bring people together. I have a practical question. We have actually begun to, we've looked at the GCCHE competencies, and we've begun to use those to think about a more full integration of climate change and health. And you mentioned that there's a new set coming out this year, and I'm just wondering, will they contain the same elements, those, communication, clinical education, etc.?
Yes. Do not fear. We thought about this because, a lot of people were saying, oh, well, we've based our curriculum on this. Like, you guys can't change this. 90% of it is the same. And then there's like a few more things that we've really kind of woven in that I think are more contemporary sort of ideas and things. So no, 90% of this is the core. And it is still, organized into those 5 major categories. And so I think it'll just be sort of ways to think about, oh, how could we teach this class slightly differently next year? Oh, here's a new idea. Here's a new, a competency that we can sort of think about. So it's meant to really just sort of spur, innovation, not to sort of make anybody feel like, oh my gosh, we have to revamp this. So don't worry. Yeah.
And I'll tag on to that. The competencies are remarkable. They're really helpful. And I just wonder, where are our accreditation organizations here? And I wonder about the role of, really the mandate. And do you have any thoughts or any feedback on that?
Yeah, it's super interesting. And I think that part of our work is really, for example, we partner with ASPPH, right? They're the Association of all the schools of public health in the US, and we're co-producing, materials with them. And so how do you get that, so we can, that's sort of like, the associations can suggest things to their members, they can provide resources, but you're right, like when push comes to shove, what are schools going to have to teach? And so we presented this toolkit to CEF, so the Council for Education for Public Health, to their board of directors about 6 months ago, because they are undergoing a curricular revamp in 2026. But they start now. So, I think this is where we sort of have to really keep the pulse of what's going on. And I mean, the Council of Public Health is one example. We can also think about, other licensure exams, right? I mean, this is sort of a trickier issue, but, a lot of schools teach to the test. Like, how do we credential health professionals? I mean, that's another area where we sort of keep really close eyes on. And then the other area is sort of thinking about the ACGME, right? They produce competencies for how residents are trained, right? And so thinking about how we can use our collective voice, one, to keep track of what the heck's going on in all these spaces, so we know when we need to kind of strike, and two, do we have the materials and the right advocacy plan to be able to work with these organizations? And I think that, people sort of ask, well, does the GCCHE do advocacy? And I say, no, not really. We form partnerships. And I think that, there is will among leaders to do this. And I think that we can come in as strategic partners to help organizations do it better. And I think we just sort of have to think about how we forge those relationships to be able to strengthen our institutions. And we don't need to reinvent the wheel. We just need to sort of upskill all that we're doing. But yeah.
Wonderful. And I just to keep, I have a few more thoughts, and we have a few more minutes if you still have some time.
Sure.
So you've talked to us and our audience about what they can do depending on where they're at, who they are. And you showed a number of ways to get involved and what's up and coming in the next year. And I'm curious, what do you see for GCCHE even beyond that? So are there other visions that you have, other scope for your work?
Yeah, that's such a great question. And, you know, as I sort of alluded to, like when we started, we were 60 institutions, and now we're over 300, and we get new members every day from places that I've never even heard of or been, right? And so, you know, the grand vision that I have is that we really need to be forming regional hubs, because, you know, your earlier question, like the intricacy of being able to integrate climate and health at a local level, at an institutional level, at an association level, like it takes on the ground people and it takes on the ground knowledge to be able to do it. And so, you know, think globally, act locally, right? The hippie expression, but like, I think we need hubs, right? So we're in the process now of thinking about how to build a hub in Australia. And that's like one of my first goals, because the time zones are just so hard to work with. But then thinking about how do we build a hub in, you know, in each continent to really sort of be that local presence. I think that's where we need to go with this. Yeah, that's one thought. I mean, the other thing we're really hoping to do is, one of the biggest barriers is really for students, for faculty to have the support they need to do this work, because it's so hard. I mean, people are working after their day jobs to try to get curriculum into their schools. Like, how can we support it? How can we get grants? In my ideal world, we have a fund where, we take on 15 faculty fellows every year. We put them into a learning collaborative and they support each other. We support them and they go and do the hard work, but they're funded to do it. Right. I mean, that's the biggest piece I think we're missing is equipping people with the resources they actually need to be able to do this work. So those are my two visions, Winnie. And again, sort of just thinking about, how can we continue to bring in new members and support them however needed. One of the cool things we started doing was having this buddy program. So getting schools to link in different places. So we facilitated the first match between Tel Aviv University and Jefferson University, and they're now running a virtual interprofessional course on climate and health.
Wow.
Faculty from both regions. But I think there's more of that we can do, right? So we can sort of have a matching buddy program in the GCCHE to sort of really increase our global thinking about this.
I love that. And I love the hub too, because as I think about resiliency, like how much, we do as an institution, we really need our neighbors. And even though you're connecting us globally, regionally is how we develop, I think, climate preparedness, right? So a lot of what I do, we could work together, or not, I meant my hospital, so in terms of whether it be supply chain or, so I think that regional hub thing is wonderful. And just my last comment is that the one place that I was questioning you was when you said we do tertiary prevention well. And here I am thinking about how did we handle the COVID pandemic? How did we handle the Hurricane Maria? And I'm curious, is that what you're referring to, that we handled well, or
maybe? Yeah, right. No, thanks for making me back up there. I think I moved too fast. Maybe I don't mean that we do it well, but we devote most of our resources to it financially and economically. Gotcha. So we wait for a crisis and then we spend billions of dollars. That's what I mean. We focus our resources on tertiary. With that, instead of building a good public health system and, doing all these things ahead of time, I think is where I was trying to go with that.
Gotcha. Thank you. I have, this has been so fantastic, and this is recorded, and I know a lot of our audience has been asking about that. So they can go back and get all those classes and podcasts, etc., which I did drop in the link. So thank you so much. I appreciate the time.
Yeah, wonderful to be here, and look forward to connecting with anyone who's interested. My email is on the website, and I can also just drop it in the chat. So thank you all.
Thank you. Oh, and Clint, do you have the last slide? If that's not available, I'm just going to tell everybody who's still on. that thank you, Clint. Next month's speaker is going to be about climate smart healthcare, the next frontier for health professionals. Our speaker, Shanda DeMorest, will be from the School of Nursing and University of Minnesota. I also want to just highlight the symposium on April 1st. It's a virtual symposium, Eastern Time, 8:30 to 12:30. It's going to be a symposium focusing on sustainability action and how it affects planetary health and human health. There is continuing education credits available, so for not very much of a registration fee. So please join us. Thanks, everyone.